welcome. I would like to start with a land acknowledgement. At Pine River Institute, we recognize that our work, the work of our community partners, takes place on the traditional indigenous territories across the province. We are thankful to be able to work, live, and play on these territories. And welcome, welcome. We are so happy to host you here today. What a wonderful day for the Pine River Institute and the youth and their families who need our support. It has been 15 years since Pine River opened its doors to our first students. In that time, we have focused on refining our clinical approach, learning from our research and evaluation, and expanding our scope to impact families even before they use our services. Our program is very unique. It is a seamless four-stage approach to treatment. Wilderness. Our students in Stage 1 are paddling and portaging in Algonquin Park even today. A residential component here on campus, which combines therapy with full accredited high school education program. Gradual transition through a progressive discharge back home and community, and aftercare support. Our model enhances adolescents' maturity, so when our students graduate, they can reclaim their lives, they can reclaim their families, they can reclaim their future. And families and caregivers play a vital role to our treatment. Their engagement and development alongside their child is critical to sustainable success. We have built an ongoing evaluation in our mission and our values at Pine River, and we've been tracking our impact since day one. We know that our approach works for many youth and families who have turned to us. We can confidently say that we make a difference that lasts. And as you know, it is more than bricks and mortar that makes a great program, and it is more than bricks and mortar that makes this program great. Our talented and dedicated team of staff really makes a difference. We have attracted a truly all-star team of individuals at all levels in the organizations. Unfortunately, at any given time, there are more than 200 students and families waiting to have a spot here. And the average wait time is still more than 14 months. As a result, our #1 priority over the last few years have been to increase our capacity and serve more youth and their families. And thanks to our extraordinary donors, we have been able to build this magnificent building that has provided us a chance to do exactly that. This building was created through a hard work of the Pine River Foundation, which is our sister organization whose primary mission is to support the work of the Pine River Institute. And it plays an essential role in our growth and impact. In particular, I would like to thank Craig Moffat and his partner, Dr. Louisa Habent, who were the lead donors in the creation of Moffat House. Their support was truly transformational. I would also like to recognize Nancy Ham and John Sinclair from the Pine River Foundation Board. Nancy is a past chair of the Financial Board, and John is a current chair, and their relentless work to support the Institute is inspiring. We are delighted they are both here today. And today we celebrate a significant next steps and appreciate the generous support of the Government of Ontario, allowing us to expand the number of youth and families that we can serve. And I want to thank in particular Minister Christine Elliott, who has been a tireless advocate for youth struggling with a variety of challenges, including those with addictive behaviors and other mental health concerns. Minister Michael Tibollo, whose backgrounds and expertise in residential treatment and his tireless work in this portfolio have been crucial to this wonderful investment. And of course, our MPP, the Honourable Sylvia Jones, who has been a friend and a sage counsel to Pine River year after year. Our slogan at Pine River is "Hope is a place." Thanks to you, ministers, and your team, hope will be a place for many more. So please accept our appreciation and gratitude on behalf of the Pine River Board, the entire Pine River community, and all those who will benefit in the future from this wonderful treatment. Thank you. And now I would like to welcome Minister Jones to make a few remarks.
Well, thank you and good morning to students, staff, friends, board members. Welcome to Dufferin County and Pine River Institute. It is an incredible pleasure for me to join you today in this announcement. You know, I have been an avid watcher, listener to what is happening here in Dufferin County at Pine River Institute. Minister Elliott and I had the pleasure very early on of touring and visiting and learning about what PRI was doing, and of course Minister Tibollo when we started to learn about this new beautiful building that you'll hear more about very shortly. The ability for me to come and highlight what has been happening in the beautiful hills of Mulmur is very important to everyone, but most importantly to the youth of Ontario. And I have to say to the board members, thank you for your persistence. You know, you have been operating and working tirelessly for many years, sometimes with government support, sometimes without. And I'm just happy that we're able to continue our investment here because we see what a difference it makes to the lives and families of students across Ontario. So with that, it's my honor to introduce and welcome back to Pine River Institute Minister Christine Elliott.
Well, thank you very much, Minister Jones, for your very kind introduction, and good morning, everyone. To everyone from Pine River, to the board members, the foundation board members, and especially to the young people. You're the reason why we're all here today. It's a pleasure, a real pleasure to be here in Mulmur today celebrating Recovery Month with Ministers Tibollo and Jones, and to all of you here at Pine River. So thank you very much, Edita and the team at Pine River, for hosting us today. As we wrap up Recovery Month, I want to thank the many healthcare workers here at Pine River, at Addictions and Mental Health on Ontario, and in the community for all of the work that you do to support Ontarians on their journey to mental wellness. I want to especially thank Adrienne Spafford, the CEO of Addictions Mental Health Ontario, for your dedication to ensuring that Ontarians have access to the supports and services that they need. And of course, we wish you very well in your new future role. Since day one, our government has been committed to building a mental health and addiction system that works for Ontarians no matter what age. Supporting the health and well-being of children and youth has never been more important. We know that when children and youth are struggling, communities and families are struggling as well. That's why I am very pleased to announce today that our government is providing over $4.2 million in additional funding annually to support the expansion of Pine River Institute's mental health and addictions treatment for youth. As part of the expansion, we are expanding and to add 30 new treatment beds to the program in this beautiful facility that's already here, and improving access to mental health and addiction services so that youth can receive the care that they need when and where they need it. Today's investment is part of our roadmap to wellness. Our government's plan to add more than $3.8 billion over 10 years to build a comprehensive mental health and addiction system. Our government is committed to putting kids and families first by ensuring they have access to safe and effective supports in their journey to mental wellness. Together, we are investing in the mental health of children and youth now and well into the future. So thank you. It's such a pleasure to be here. And now I would like to invite Minister Tibollo to come forward to say a few words. Thank you all very much.
Thank you, Minister Elliott, and thank you for all the work that you do, not just in health, but in mental health as well, to ensure that the people of the province are looked after, and for indulging me sometimes with the questions and the issues that I deal with. And Minister Jones, while she said that she watches and listens, there isn't anyone that advocates as strongly when it comes to youth and children and youth mental health. So I want to say thank you to her as well. And to all the VIPs here, I want to say thank you as well for the great work that you do, because the work that you do, the volunteering that you do, has made something like today possible. And to the kids, I want to say, when I was working in the sector myself, we used to call the people that were in the programs TIPs. TIPs are truly important people, and we can't underestimate the dedication and the fact that you're here wanting to improve your lives. So I want to say to you, continue your work. There is the other side that where you have control of your life again, and those are important things. These are steps that will be foundational to your recovery, to you being able to do whatever it is that you want to do. So continue dreaming, continue with that passion to want to do better and to want to do more. For me, it is truly a great day to be here at Pine River, and I want to thank you for hosting us. And I want to thank you as well for the incredible work that you do for people that have mental health and addictions issues, and looking after and caring for the youth and the families across Ontario. You know, when you think about our children, the children are our future, and doing work now is critical to ensuring that the issues are dealt with, the people are given the help, and the changes can be made early on. We're here today, and you know, this is a very important month in the province of Ontario. Earlier this year, our government passed the Recovery Month Act to proclaim September as Recovery Month, to recognize and support those that were recovering from addictions, raise awareness of the mental health and addictions challenges Ontarians face every day, and reduce the stigma. All these very, very important and critical to recovery. During Recovery Month, we encourage all Ontarians to continue working together, supporting one another, and help spread the message that treatment does work, and stigmas around addiction and recovery must always be challenged. With that in mind, it's truly an honor and a privilege to be here today at Pine River to speak about an issue that is very near and dear to my heart. Prior to taking office, I spent several years, 10 to be exact, as the chair of a bed-based therapeutic community where I eventually became a certified addictions counselor. I helped many individuals from all walks of life who were struggling with their mental health and substance use. As Associate Minister of Mental Health and Addictions, I've heard about the struggles that many Ontarians face with addictions and mental health, especially during the pandemic, and especially the youth during the pandemic. And throughout the pandemic, we've seen an increased demand for mental health services for children and youth across the province. And that's why today I'm very pleased to be here to share this great news announcement. Every Ontarian struggling with an addiction challenge deserves a second chance and a good and meaningful life, and that includes our youth. In addition to the funding being announced today, earlier this year we announced another historic investment of $31 million to help improve access to specialized mental health treatment services, to reduce wait lists and wait times, and support the mental health and well-being of children and youth. Through the Roadmap to Wellness, we're committed to creating a system where Ontarians of all ages have access to the highest quality mental health and addiction supports when and where they need them. And we'll continue to work with our community partners to ensure that all Ontarians struggling with mental health and addictions have access to the highest quality supports and opportunities for treatment and recovery. I want to thank you all again today, and I'm going to pass it over to Adrienne Spafford, CEO of Addictions and Mental Health Ontario, to say a few words. Thank you so much.
Thank you, Minister Elliott, Associate Minister Tibollo, and Minister Jones for having Addictions and Mental Health Ontario here today. I'm very pleased to join you on behalf of more than 200 mental health and addiction service providers across Ontario to recognize September as Recovery Month. It is so fitting that we are here today at Pine River Institute, a leader in treatment for youth with addictive behaviors, and a place of hope and a place of development for many. Each and every day here, the students, their families, and the amazing staff, led by Vaughn Dowie, work so hard at recovery. I was here for the first time 5 years ago, and Vaughn was just pointing over there at an empty space in the field and talking about the dream he had for this building here. And I'm so happy the Ontario government is announcing these new beds today. And he said, you know, the kids deserve a better place to live while they're here. And I'm so happy that they're getting it because they deserve it. They work so hard to address the underlying mental health challenges and history of trauma that often contribute to addictive behaviors, to learn and develop new skills and resiliency, to build stronger and better relationships with their family, all in the goal of a possibility at a future, at a family, at happiness, at a career, at getting back to school and back home. Pine River is the perfect example of what's possible when we support those struggling with addiction or substance use. But the first step for many who live with addiction or who use substances is often the hardest step, and that is reaching out for help and support in the first place. That is why September is such an important month to Addictions and Mental Health Ontario and to the broader addiction and mental health sector in Canada. It's a month where we are focused on fighting the stigma that remains around substance use. While we have made a lot of progress in Canada, in Ontario, specifically when it comes to mental health, addiction and substance use remain highly stigmatized in our society, and that makes people get sicker, and sometimes it causes death. Many people fear reaching out for help because they remain concerned about the impacts of how they will be judged by their family, their friends, their peers, their employers, and even their healthcare team. We cannot continue to allow this to be the story for people who live with addiction in Ontario. And as citizens, we each have a role to play. We need to recognize that people living with substance use challenges need to be met with the services and supports that will treat their individualized needs, whether that be supervised consumption, clean supplies or other harm reduction services, peer support, withdrawal management, outpatient or live-in treatment, housing, income, and food security. People need the services and supports that will work for them, just like the youth who need the services here at Pine River, and now will receive them faster thanks to today's investment. I want to thank the Ontario government for being here today and for helping to mark the first official Recovery Month in Ontario, thanks to MPPK and his private member's bill. I also want to thank all of the mental health and addiction workers across the province, including here at Pine River, as well as the volunteer board members and all of those who have donated funds for this project. And I want to thank all of you who have shared your story this Recovery Month. It is you, above all, who continue to stand up and challenge stigma. Thank you.
Jamie? Aye.
A couple of weeks ago, nurses and doctors being harassed by anti-maskers as they went into work. This weekend we see anti-maskers assaulting police, wrestling with security guards to try and get into the Eaton Centre because they think it's their constitutional right that they go into the Eaton Centre. What does the government have to say to these people that are carrying out these protests?
Well, first of all, we recognize that people have the right to demonstrate peacefully. That is within their rights, but not to get into angry confrontations, not to fight with police, not to fight against the rules that we already have that are encouraging people to be vaccinated. If you choose not to, fine, but other people do choose to. The vast majority of people have chosen to be vaccinated. We now have over 85% of our adults, people age 12 and over who have received their first vaccination. We want to get it up to 90% because we know that is really important to protect everyone in Ontario. The health and well-being of the people of Ontario is our government's top priority. And so if you don't want to receive the vaccine, fine. But a peaceful protest is fine, but angry confrontations where people can be hurt is not all right. It's not okay.
There was a poll released that showed that people that are vaccinated are starting to build an intolerance or are being angry at the people that aren't vaccinated. And this is causing a polarization, which resulted in what we saw yesterday. This separation, is this mendable? Is this is the government can give words to advice to these people?
Well, we'll continue giving the advice to people that we always have, which is the best way to protect your own health and well-being, that of your family, your loved ones, your community, is to be vaccinated. We have safe and effective vaccines in Ontario that have been thousands, millions of people have already had them. We're going to continue to ask people to be vaccinated. We do have our vaccination certificate now that is required to go into many places, to restaurants, to fitness studios and other locations. So we're going to encourage people to please be vaccinated. That's the best way to protect yourself and the people that you care about.
Okay.
Hi.
Hi. The Toronto Medical Officer of Health is asking the Ontario government to add COVID-19 vaccines to the mandatory vaccines for students. Can we please find out if you are considering this?
Well, we're going to take a look at anything that is going to protect people, including young people. We know that the take-up of 12 to 17-year-olds has been very good with respect to receiving the vaccines. Now we're waiting for finalization on whether the Pfizer vaccine in particular can be used for children age 5 to 11. That is something that is important. We want to have as many people vaccinated as is safe and possible. So we are continuing to look at ways that we can continue with that, and that is one of the ways we're looking at.
Well, this facility, there was always a deficit in facilities like this coming, and there still is. How much more are these facilities going to grow, and are they going to be able to keep up with the people that are in trauma or in crisis as a result of COVID?
Well, we're continuing. We knew that as a result of COVID, there was going to be an increase in the mental health and addiction needs of people across the province of Ontario. Youth are no different. There's been a lot of stresses and strains for everybody during the course of this pandemic. And so we know that the need is going to continue to grow. It's going to be with us for some years. And so we need to have more facilities. I think that Pine River was very forward-looking, I guess, in terms of having this beautiful facility already available, and so we will be able to open the beds here by March of 2022. But there will be other places. There are other facilities in other parts of Ontario that we are going to continue to encourage to expand as well, and that is something that has been a priority for our government, the mental health and wellness of all of our residents, no matter what age, and that mental health is health. It needs to be looked at in the same way that we look at physical health. So we're going to continue to expand to make sure that anybody who has a needs for their mental health or addictions challenges will be able to get those services in a timely manner. So thank you very much.
Thank you.